Mastering priority setting for safe and effective patient care. Understanding priority setting. Priority setting represents the critical process of deciding which patient needs require immediate attention to ensure safe and effective care delivery. Definition: the systematic process of determining which patient needs should be addressed first. Purpose: improves patient outcomes while preventing life-threatening situations. Benefits: enhances time management, reduces stress, and improves teamwork efficiency. Foundation: based on patient safety principles and evidence-based practice guidelines. 3 levels of priority setting. Understanding priority levels helps nurses make appropriate decisions about patient care sequencing and resource allocation. High priority, life-threatening. ABC assessment, airway, breathing, and circulation problems. Vital signs significantly outside normal parameters. Loss of consciousness, severe pain, or active hemorrhaging. Situations requiring immediate intervention to prevent death. Intermediate priority, non-life-threatening. Wound care procedures and medication administration. Monitoring for changes in patient condition. Addressing moderate pain or abnormal laboratory values. Situations requiring prompt attention but not immediately life-threatening. Low priority, routine or future needs. Patient education and long-term care planning. Emotional support and psychosocial interventions. Hygiene assistance and comfort measures. Activities that can be safely delayed without harm. Maslow's hierarchy and nursing priorities. Maslow's hierarchy of needs provides a framework for understanding patient priorities in healthcare settings. Physiological needs, most urgent. Oxygen, food, water, elimination, and sleep requirements. Basic survival needs that must be met first. Example: treating severe dehydration before addressing emotional concerns. Safety and security needs. Fall prevention measures and infection control practices. Medication safety and environmental hazard management. Protection from physical and psychological harm. Love and belonging needs. Social support systems and family involvement. Therapeutic relationships and emotional connections. Community resources and support groups. Self-esteem and self-actualization needs. Emotional support and confidence building. Patient education and skill development. Personal growth and goal achievement opportunities. ABC assessment framework. The ABC approach provides a systematic method for identifying the most critical patient needs requiring immediate attention. Airway assessment. Is the airway open and unobstructed by foreign objects or swelling? Can the patient speak clearly and breathe without difficulty? Are there signs of choking, trauma, or airway compromise? Breathing evaluation. Is the patient breathing effectively with adequate rate and depth? Are there signs of respiratory distress or inadequate oxygenation? Does the patient require supplemental oxygen or ventilatory support? Circulation assessment. Is the heart pumping blood effectively throughout the body? Are there signs of shock, hemorrhage, or cardiovascular compromise? Are vital signs stable within acceptable parameters? Priority example: a patient with difficulty breathing should receive attention before a patient with elevated temperature. Acute versus chronic conditions. Distinguishing between acute and chronic conditions helps nurses prioritize care appropriately and allocate resources effectively. Acute conditions. Develop suddenly and require immediate medical attention. May be life-threatening without prompt intervention. Examples include stroke, sepsis, heart attack, and severe trauma. Take priority over chronic condition management. Chronic conditions. Long-term health problems requiring ongoing management. Develop gradually over time with periodic exacerbations. Examples include diabetes, COPD, arthritis, and hypertension. Important but generally less urgent than acute conditions. Practical application: a patient experiencing sudden chest pain, acute, requires immediate attention before routine diabetes education, chronic management. Urgent versus non-urgent classifications. Understanding urgency levels helps nurses make appropriate decisions about timing and resource allocation for patient care. Urgent needs: immediate action required. Respiratory distress or breathing difficulties. Severe pain requiring immediate intervention. Active bleeding or signs of hemorrhage. Sudden changes in consciousness or neurological status. Abnormal vital signs indicating physiological compromise. Non-urgent needs can be safely delayed. Routine vital sign monitoring on stable patients. Long-term dietary education and counseling. Emotional support and psychosocial interventions. Dressing changes on healing, stable wounds. Administrative tasks and documentation. Time-sensitive nursing tasks. Certain nursing tasks have specific time requirements that affect patient safety and care outcomes. Tasks requiring immediate action. Administering 4 medications for critical patients. Responding to monitor alarms including cardiac and ventilator alerts. Checking post-operative patients for surgical complications. Managing emergency situations and code responses. Tasks that can be scheduled later. Routine patient assessments on stable individuals. Documenting non-urgent clinical findings. Providing discharge education to stable patients. Completing administrative paperwork and reports. Practical example: administering insulin to a diabetic patient with dangerously high glucose levels takes priority over routine morning hygiene care. Delegation and prioritization. Effective delegation enables nurses to manage multiple priorities while ensuring appropriate care delivery and patient safety. LPN prioritization responsibilities. Administer medications according to established schedules and protocols. Perform wound care, tube feedings, and suctioning procedures. Monitor patients for changes and report significant findings. Coordinate care with other healthcare team members. Appropriate tasks for UAP delegation. Assisting with activities of daily living including bathing and toileting. Ambulating stable patients and providing position changes. Taking routine vital signs on patients with stable conditions. Feeding patients without swallowing difficulties or aspiration risks. Priority decision example: an LPN should personally assess a post-operative patient complaining of severe pain while delegating routine hygiene care to a UAP. Nursing process and priority setting. The nursing process provides a systematic framework for establishing and adjusting priorities based on patient needs. Assessment phase. Identify critical needs through vital signs, pain assessment, and laboratory results. Gather comprehensive data about patient condition and responses. Recognize changes in patient status requiring priority adjustments. Diagnosis and planning phases. Determine urgent versus non-urgent problems based on assessment findings. Set priorities using ABC framework, Maslow's hierarchy, and urgency classifications. Develop realistic timelines for addressing identified patient needs. Implementation and evaluation phases. Take immediate action for high-priority patients and life-threatening conditions. Continuously reassess and adjust priorities as patient conditions change. Document interventions and patient responses to guide ongoing care. Common prioritization mistakes. Recognizing and avoiding common errors helps ensure effective priority setting and patient safety. Frequent mistakes. Focusing on non-urgent tasks while ignoring critical patient needs. Failing to recognize and respond to abnormal vital signs. Not reassessing priorities as patient conditions change throughout the shift. Poor delegation resulting in task overload and inefficient care delivery. Prevention strategies. Always reassess patients using ABC framework and physiological priorities. Prioritize critical interventions over routine care activities. Communicate effectively with healthcare team members about patient changes. Maintain flexibility to adjust priorities based on evolving patient needs. Summary and professional development. Effective prioritization ensures safe and efficient patient care by addressing the most critical needs first. Using frameworks like Maslow's hierarchy, ABC assessment, and urgency classifications helps guide decision-making. Acute and life-threatening conditions take precedence over chronic and routine care needs. Appropriate delegation and continuous reassessment enable nurses to manage multiple priorities while maintaining patient safety. Key takeaways for practice. Patient safety always comes first in priority decisions. Systematic frameworks guide effective priority setting. Flexibility allows adaptation to changing patient conditions. Effective delegation optimizes care delivery and efficiency. Thank you for learning about establishing priorities. These skills enable you to provide safe, effective care while managing multiple patient needs and responsibilities.